Transforming your life with hypnotherapy just got easier with your host, Julie from CoachingHypnosis.net.
Welcome back, dear listener, to Coaching Hypnosis. I'm your host, Julie. We've built a formidable toolkit for performance enhancement. However, as with any high-powered tool, it is vital to understand the limits of its application. Just as you wouldn't use a wrench to perform surgery, you wouldn't use performance coaching to treat clinical conditions. Today, we look at the standards set by the American Society of Clinical Hypnosis. Understanding these guidelines is not just about ethics, it's about your safety and long-term sustainability of your athletic career. The ASCH guidelines draw a bright line between two distinct realms. One, performance coaching, our realm. This is for athletes who are essentially healthy and looking to optimize their potential. We're talking about focus, motor skill acquisition, pre-event anxiety, and recovery. This is about taking on an 8 and turning it into a 10. 2. Clinical intervention, professional realm. This is for deep-seated issues that interfere with daily life, such as diagnosed anxiety disorders, clinical depression, PTSD, or trauma-based phobias. This is about taking a 2 or a 3 and bringing it back to a baseline of health. Why the distinction matters. If an athlete attempts to use performance scripts to mask deep clinical symptoms, they risk burying the problem rather than resolving it. Clinical hypnosis involves diagnosing and treating underlying psychological structures. Performance hypnosis focuses solely on externalized goals and skill optimization. When to seek a professional. You should transition from self-help to a clinical professional if you notice the wall. Your performance anxiety isn't just game day nerves, but a paralyzing state that prevents you from even starting your training. Persistent distress. Your emotions remain stuck long after the event is over, affecting your sleep, your relationships, or your sense of self. The why is too heavy. If you find that your fear of failure is rooted in past trauma or significant life events rather than just the pressure of competition, use this simple diagnostic. If your hypnotic protocol increases your sense of control and clarity, you are in the right lane. If your protocol feels like you're trying to silence or hide emotions that feel overwhelming or heavy, it's time to reach out to a licensed professional. In your session today, do a mental audit. Rate your performance anxiety from 1 to 10. If you're consistently above an 8 and it feels heavy rather than just alert, take the time to research a clinical hypnotist or sports psychologist in your area. Seeking professional support is the ultimate mark of an elite athlete. It shows you are committed to your long-term health, not just today's score. Tomorrow, we're going to synthesize everything into your athlete's resilience toolkit. Until next time, prioritize your health, stay self-aware, and know when to call in the experts. My coaching tip for today: there's no shame in seeking clinical help. In fact, many Olympic-level athletes have a mental performance team that includes both a coach for skill building and a clinician for psychological maintenance. It's the ultimate super team approach. Mindfully yours, Julie.